And good evening, everyone, and welcome to this meeting of Local Outbreak Engagement Board. I'm Councillor Graham Bridgman. I'm Deputy Leader of West Berkshire Council, and I am chairing this board. I am looking around the room to see who I'm supported by this evening, because I can't yet see Councillor Stewart. I think she is due to attend. But other members of the council have Councillor Doherty, Councillor Bowick, Councillor Vickers and Councillor Masters. We also have with us Matt Pearce, who's Service Director for this particular bit of the council, Sean Murphy from the Public Protection Partnership, Martin Dunscombe, our Communications Manager, Joe Reeves from the CCG, and by no means least, Nigel Lynn, who's Chief Executive of the council. Tracy, you'll need to rename yourself, because at the moment you appear to be Matt. So if top right, I think you'll find a few dots and you can choose rename. Right, everybody, I do apologise, I've forgotten Gordon Oliver, who is clerking the meeting and is Zoom host. I think I've covered everyone now. Fine, let's move on. So first item on the agenda, I think, Gordon, is do we have any apologies?
Yes, we've got apologies from Andy Sharp and from Katie Summers. Fine,
okay, thank you for that. Next, members, you have minutes of the last meeting, which was held on the 24th of January. Does anyone have any amendments they wish to make to those minutes? Don't see anyone putting their hand up. So I'll propose those from the chair. Does that find a seconder? Yes, thank you. Well, I'll take Councillor Doherty's seconding. Sorry, Councillor Bowick, did you have an amendment? No, you were just getting in there early. Fine. Okay, yeah, those in favour. I'm going to put my hand up. I'm going to put hands in front of the screen in that time-honoured fashion to agree the minutes. I think they're agreed. Thank you. Let's move on to declarations of interest. Does anyone have any particular interest they wish to declare to this meeting? I see not. So we now move on to COVID situational report, and that's Matt, I think. Over to you, Matt.
Thanks, Chair. Just a few slides to take you through this evening. The first summary slide I'll be familiar with. I won't go into too much detail. So in general, we're seeing the cases per 100,000 across all local authorities in Berkshire going down. And we've got West Berkshire highlighted here. So I think the latest is just shy of 1,000 per 100,000. So that's the latest information we've got today. The positivity rate is 16%. So 16% of all those that are going to be tested are testing positive. We do need to be cautious into some of this data, just because we're not always sure people are registering their lateral flow tests. So there's lots of caveats. So I just wanted to make that point. The other point I wanted to make is we are seeing a slight increase in our cases per 100,000 60 plus. I'll go on to hospital admissions in a second, but we're not seeing any significant rises in those. I think it's important just to point out we are still seeing a lot of cases, so over the last 7 days, 1,749 individuals tested positive for COVID. So still big numbers, and there's still lots of uncertainty around the impact around non-COVID and those other consequences. So if you just look at the epi curve, you can see that downward trend, the blue line representing West Berkshire, the orange line representing the southeast, and in the England, the grey line. And you can see West Berkshire, the southeast and England are all now going down, but again, we just need to be cautious in terms of some of those numbers. I showed you this graph last time, which is about a month ago. I think we held the last LOAB. So this just really shows the age-specific COVID-19 case rates per 100,000. So if you recollect, it's just around the 24th of January, I think the last time we met. And I've just illustrated this red dotted line. If you recall, the 5 to 9-year-old age groups, we're seeing quite a significant rise. Following that, you can then see quite a downward trend in the 5 to 9s, as well as the 10 to 14-year-olds. There are some slight increases in the 15 to 19-year-old age group here, and the 60+ age group as well, which I just reiterated on that previous slide. So just giving you a sense in terms of where things are at across the ages. Certainly the primary school activities is quieting down It's a lot busier a month ago. We're just seeing a slight increase in that secondary school age group. It could be that we're seeing reinfections. So we know that people that previously had the Delta variant, they might be reinfected with Omicron. Some of the evidence also around the Omicron variant is actually the immunity seems quite strong, so people aren't being reinfected quite as quick. So that's some early studies coming through on that. In terms of the hospital data, so as always, we're largely seeing those individuals that get seriously ill tend to be unvaccinated in hospital. So that remains the case. There's still a stable level of activity, not sure if that's the right word to use. So patients in hospital on the 8th of December, 77 patients. So it's a little bit of an uptick there. But again, it's uncertain whether those are community acquired or acquired in hospital just because of the general high prevalence. But a large majority of those patients aren't necessarily seriously ill, so it's important to make that point. And on the 8th of February, we had one patient currently on mechanical ventilation. So certainly still busy in hospitals, but nowhere near what we saw in that January peak of last year. Obviously, with the deaths, we still continue to report those deaths. So sadly, 3 in the last week. There's been just shy of 300 COVID deaths since the start of the pandemic, and this represents a 16% increase on all-cause mortality rates over the 5-year average. So if you just have a look to the right-hand side of this graph, the grey line representing that 5-year average, we're in line for what we would be on that 5-year average, and those blue bars just representing those COVID-related deaths. I just thought I'd just do one very quick slide, really, because I think there's lots of outstanding questions about what the future holds. So it's just really some of my thoughts on this. And I've titled it Living Safely and Fairly with COVID-19, which I think is hopefully self-explanatory. But we're expecting the government to set out a long-term strategy for living safely with COVID. So we're very, very much waiting to see what the contents of that will be next week. And that will inform us as a local authority and our system partners about how we respond to COVID going forward. And we likely believe that they're going to lift some of the remaining restrictions and that need to self-isolate when people test positive. So certainly something we're waiting to see. We do expect the virus to become endemic, but that doesn't mean that it's harmless. It means just accepting that the disease will circulate, because elimination or eradication is quite difficult or costly. I think we have to recognise as well, though, without wanting to be too much of a pessimist, there will be future surges, most likely in the winter, and we need to understand how we plan and deal with those, and particularly protect the most vulnerable in our communities. So we need an ongoing plan for that, and that will likely be informed by the government's long-term strategy that's published next week. And I think it's important to note, pending the outcome of that strategy and what's in it, is there are still things that we can do. So vaccination inevitably remains the most important thing that people can do, because we know it protects against serious illness, hospitalisation and death. So just that core really, and to encourage people to get their boosters. If they haven't had a first jab, to get their first jab. It really does help. And we also know that vaccination can play a role in reducing the impact and prevent long COVID as well. Ventilation, again, there's things that people can do to improve ventilation in indoor settings. Face coverings, although there won't be any mandatory requirements to wear any face coverings, there's still things that people might choose to do in certain situations. And washing hands regularly, and that can prevent a whole range of infectious diseases in good hygiene practices. And then testing, we do think there'll be some testing that will remain for surveillance and diagnostic purposes, but again, we're waiting to see what is announced next week. Just a few final points for me. Long COVID obviously just remains a concern. I know there was a note in the minutes, Chair, from the last action. We're still trying to identify the exact numbers of long COVID in West Berkshire and beyond. It's really difficult around different definitions, and it's down to modelling. So that's an ongoing concern for us, and about what services are out there to support them. And obviously we need to be aware of emergence of new variants and how local systems can step up. And last but not least, again, it's just about tackling those most vulnerable in our communities and tackling those existing inequalities that COVID-19 has shone a light on. So just a few thoughts from me. That's all I was going to cover. Thanks.
Thanks, Matt. I'll come to members in a moment. One thing I wanted to say, and I left it till now, is that members, you'll know that, and we'll discuss future meetings later on in this meeting, but you'll know that we left it last time that I would be having a conversation with Matt and Tracy as to whether or not to call a future meeting of this board. We had that conversation, and indeed here you are. But I think it would be wrong of me now not to say that this may be Matt's last West Berkshire LOEB. You'll know that Matt is departing for pastures new. We'll get a chance to say a proper farewell, I hope, on Thursday in Health and Wellbeing Board. But I do want to reflect now in public the enormous effort that Matt and his team have put in relation to COVID. It has been an absolute shift of work. And I want to say thank you publicly to Matt for the lead he's shown in relation to the COVID pandemic and the efforts of West Berkshire Council in relation to it. I won't say any more than that. I'm sure we all have the similar sentiments, but Matt, thank you. Matt, a couple of questions, or points perhaps. One is a reflection on the text that I found in relation to the Berkshire dashboard and the numbers that we've been looking at over time, and the fact that as from the 31st of January, they started counting the second, as it were. If you got COVID a second time, it was counted as a fresh incidence, whereas previously that had been wrapped up in the first one. So what your thoughts are on whether that on the one hand, increasing the number, and the question as to whether people are reporting testing, decreasing the number, how that balance, that seesaw balance is playing out in terms of analysing the numbers of those with COVID, and in particular, our number per 100,000, because I think if we look at the graph, there is a little push up around the 31st, and then it drops back down a little bit. So that's my first point, and I'll give you them both. The second one is certainly to reflect, as we have reflected many, many, many times, on the fact that hospitalisation is now very much linked, in my view, and in the data I see, to those who are unvaccinated. And indeed, I think possibly to Delta as opposed to Omicron. But just to raise a question, or maybe just it's going to be a long-term discussion, and in the analysis of COVID as time goes on, about the 28-day link to deaths and how they're reported, because certainly conversations at Royal Berks that I've been having with chairman governors were to the effect that, yes, someone might very regrettably die, and they might have tested positive in the last 28 days, but the death is not in the view of the hospital, the death is not a COVID death, it's a death from cancer, death from heart disease. So there'd be some other reason, but because there has been a positive test in the last a recorded positive test in the last 28 days, there is a linkage to COVID in the death certificate. So just a reflection on what we might see as time goes on when we do the analysis of the numbers. Over to Matt.
Yep, happy to look to Tracy to help me with any of these responses. So the reflection rate, you're right. I mean, I think it's really difficult to unpick that, if I'm honest, in terms of the impact of that. When I did ask some of our analysts to look at the modelling in terms of that change in the definition, so basically positive test for any infection with COVID-19 within a 90-day time period and now considered part of the same case episode, just for those watching, and then positive tests outside of those parameters are now considered as reinfection episodes. So prior to that change at the end of January, they weren't counting reinfection episodes. I don't think there's a massive impact on our numbers, actually, when they brought in this new definition, largely because obviously Omicron only really come in around the end of December, if I'm right, at the beginning of January. So I don't think that had a significant period. In terms of whether people not reporting their data through, I think, yes, that will likely have an impact. People who are symptomatic still and should get their PCR, so that data should remain the same. I guess it's if people are asymptomatic, they take their lateral flow test, it's positive, then some might choose not to record that data. But what that actual impact is on the data, I think it's quite difficult to model. We can certainly take that one away, but you're seeing a large, one of our best baselines to compare is the ONS survey. And I think that's also showing a slight decrease in cases as well. So I think in general, we know that the case rates are going down across the population. Your second point, yeah, absolutely well made. I think it's really difficult in terms of to unpick what people's reasons are that they actually die. I think we need to remember that it's still quite a new disease, and this might have an impact on people with chronic diseases, and that might not necessarily manifest itself into the primary reason they died of COVID, but we know that COVID-19 can amplify some chronic conditions and lead to death. But we tend, as I said at the last LOEB, look at those death certificates to understand that primary cause of death. I don't know if Tracy wanted to add on anything on those 2 points.
No, I think you've covered it all, Matt. I think the death one is going to be one that we start to see a definition in at the moment. As you rightly point out, Councillor Bridgman, is that they will have a primary cause of death, and there will be people who have died with COVID rather than of COVID, but it will be how that is used for surveillance into the future, and it will be very much dependent on what we learn into the future about what those contributing factors from the virus has been on other conditions. But I think this will be an emerging picture that's researched for many years from now, and we'll continue to learn from it.
I think just to add, Tracy, and that all-cause mortality graph is really the gold standard to kind of give us an understanding of, are those death rates, really going up as a result of COVID. So as you can see from the data I showed, we're generally in line with what we'd expect. So that's really relatively positive. But obviously, every death that's associated with COVID is a sad one.
Thank you both. Councillor Vickers.
Thank you. Yes, thank you. And thank you, Matt, for all your hard work. And it'll won't be the same without you. So good luck wherever you're going. Thank you. Yeah, my not to do with the numbers, really more to do with the issue about COVID sort of becoming normal, as it were, part of everyday life, but are still wanting people to, in order to particularly to protect the vulnerable, but also, to sort of think of it not as something that's just okay, like a common cold. How we get that message across. I mean, we really need to take on the public health messages of other countries that are used to washing hands, wearing masks, like Japan. So how do we get this normalized? Because already you go out and some people are wearing masks, some people aren't. A lot of people are becoming more casual about everything. So it's getting the message across that, yes, you carry on your daily life, but you have to take these extra precautions and they should be normal. And I'm just wondering, how we get that message across. And also the issue of testing, is it that the kits are not going to be free for that much longer? We're going to have to pay for them. Is that true?
So I'll take your first one, and yeah, that's a really good point. I think we covered this briefly last time, didn't we? And I guess what I'm trying to do is develop a local plan based on the announcement next week in terms of what that long-term strategy looks like. There's clearly people that are anxious to come out. I think we talked a little bit last time about the clinically extremely vulnerable, how we support and protect them, but equally give them the confidence to go out and feel safe. I think it's a real difficult balance to strike, but I think that's something we need to work with our communications team and yeah, get other people to be considerate about how other people might be feeling. I think that's really important as well, because a lot of people haven't been out as much as they have been in the last 2 years. So that's certainly something we as a local authority and NHS are going to work together on. With regards to testing, I think I'm still waiting to see what comes out nationally around what that testing strategy looks like. I think we do expect testing to be stood down, but in terms of what the offer will be, in terms of will it be free, will people have to pay for it, I think we're really going to have to wait for the detail on that.
Yeah. It's not too, I mean, the point was not just that people who are vulnerable are still anxious. It was also about a new way of life, that people must carry on with their masks, really, I think, in crowded places. And I would have thought that's the message you'll get. We're getting messages from the health service saying that this is what you should do, but we're getting sort of government messages saying it's all okay. So it's where we're coming down. And are we going to be encouraging people to continue wearing their masks in public places, as you've just listed in that? So, it's not just that people are anxious, it's just that there's a reason to do it.
No, you're absolutely right. I think, people have to choose what they want to do and what makes them feel safe. None of this is going to be mandated. I think it's a real difficult line to tread at this moment in time. There's a lot of mixed messages, and we talked about that today internally at a meeting, because people are saying different things. Personally, I think it's going to be quite difficult. I don't think we'll ever go back to the way things were, if I'm honest. I think it is a new normal, and I think we will have to take additional precautions where we feel the need to. We just need to understand what that new normal looks like. But it is going to be slightly different to how things were. I think we possibly have to accept that.
Thank you. Thank you.
Thank you, Matt. Thank you all. I think that bottoms that one out. So we will move on to where we are with vaccinations. Joe, over to you.
Thank you. I've just got a very short slide deck for you this time, and we'll take any questions. So in terms of our headlines of the vaccination programme, as Matt said, first, second and booster doses are still available. So if you haven't been sure up to now, but now think it's the right thing for you to do, then you will be able to walk in or book an appointment, and a quick Google search will help you find that. Otherwise, there are leaflets dotted around town and the district indicating some of the sites available, or you can call 119 to get that information. Other programme updates, the vaccine has now been extended to clinically extremely vulnerable 5 to 11-year-olds and can be accessed either via some GP surgeries or the mass vaccination centre at the Broad Street Mall. You can walk in with your GP or consultant letter demonstrating that your child is eligible. The school immunisation team has also arranged to visit special schools for this age group as well. So that's a venue regularly that school-aged children may receive a vaccination. So hopefully a comfortable environment, but I'm sure parents in conversation with the school can advise of any adjustments or concerns and speak through any of those. Focus very much remains on inequalities, as I mentioned last time. Both to improve rates of booster take-up, where there's some inequity in uptake of boosters, but also the primary course of vaccination. So that's your first and second doses. And I'll come on to that in a second. And last time I reported about the vaccination as a condition of deployment for health workers and some social care workers. And those who follow the news will know that the government announced they won't proceed with that, subject to parliamentary acceptance of that proposal. So that's no longer sort of one of the arrows in our quiver, as it were. Overall, just to show an overview of vaccination take-up across the 3 local authority areas in Berkshire West. Hopefully that's big enough for you to see, but performance looking strong for West Berkshire, with 87.2% of those eligible having received their booster. And we've got some numbers there breaking down by those who aren't vaccinated and those who have had their first but not their second. So just again to reiterate, it's not too late to come forward and get your second if you'd still like to take up the vaccine, because as Matt's described, it's the best way to avoid risk of illness and hospitalisation should you catch COVID. So returning to inequalities, just a brief summary of some of the activities that we've been working on locally, just to acknowledge the massive amount of support that Health Watch have provided. So when they've been conducting community engagement in support of the targeted community testing programme, they have been sort of taking a every contact count approach and asking questions about vaccination levels and identifying any communities or any themes about feedback where people aren't coming forward with their vaccinations. And that engagement has been really helpful and led to identification of most of these actions. So a couple to highlight, for example, patients with serious mental illness. We know that patients who are on that SMI register are likely to suffer worse physical health and unfortunately die earlier than the rest of the population. So that's why we think it's so important that we do make sure that those people are as protected as possible from with the vaccination. And Dr. Heather Howells, who is a GP at Kimbry Surgery, has really kindly offered to run a Q&A session in case there are any of the members at 8 Bells or people with mental health issues that have some questions. A couple of themes have been identified when Health Watch visited with the targeted community testing. So she'll be going along to answer any questions, do blood pressure checks, offer a bit of a well-rounded holistic sort of offer there to address any concerns. And we'll be looking to do something quite similar as well in other areas for other communities. Plans are underway for a live chat event to kind of bookmark the vaccination programme, as it were. It's going to be run by Community United and is a follow-up to their Fact versus Fiction event, which they ran around this time last year, just to make contact with those communities again and make sure that we're returning to answer those questions. So we will be, as a CCG and West Berkshire Council, working jointly on promotion of that event alongside Community United, and so expect to see some more information a bit closer to the time. So that is all I wanted to cover, but I'm happy to take any questions.
Thanks, Jo. I'll just reflect one thing, which was prior to the announcement, the rollback on compulsory vaccination for frontline NHS staff. Just to reflect that Royal Berks was up at the 96% of all staff. In fact, I think they've gone a bit north of that. So I think we should reflect that, in fact, NHS staff, for whatever reason, are pretty much fully vaccinated. And, we have reflected in the previous session about how that affects the transmission and, more to the point, the hospitalisation and how ill one gets with the disease. And therefore, I think that's just good news that we should reflect on. It is good to see, regardless of the imperative from the centre, the fact that NHS staff are doubly and trebly vaccinated in most cases. Councillor Vickers.
Thank you very much. Thanks, Jo. Yeah, just obviously, I'm sure we'd all like to thank the volunteers who are out there sort of trying to get to the hard to reach communities and the work that they're doing. So thanks to them. You mentioned the Q&A session. That's quite interesting. At a Polish church, I go to one of the Catholic churches locally and my priest is Polish. So I hope we'll get more information about that, because I'd like to pass that on to him. I don't know which church. Is this St. Joseph's it's been referred to? Do you have any more information about that?
Yeah, I know your colleague in Health Watch, Alice, has been identifying those sorts of community anchors and is hoping to bring a lot of the Catholic communities together, or at least make sure, because it sounds like there's quite strong relationships between various Catholic churches. There's two
Catholic churches. There's St. Joseph and St. Francis, so I was wondering which one. I'll ask Alice, but hopefully we'll all be told so we can pass the message on. Thank you.
Yeah, definitely.
Thank you.
And I'll reflect that indeed, when we first started discussing the hard to reach, it was certainly, I remember that we had a discussion about Eastern European ethnicity in the community and how it appeared at that stage to be difficult to reach that community, to explain the efficacy of vaccination and so on and so forth. So it's good that we're engaging, well, as we have, I think, we've been engaging all the way along. It's not as if this is something new, but certainly the fruits of that work, I think, are showing, aren't they?
Yeah, I think certainly, whereas over the summer we were maybe taking a bit more of a top-down approach and identifying a community to target and then taking a van along and trying to drum up some business. This has really been about being invited in by the community. So where they've got questions and where they would welcome us to have an opportunity to answer those questions. And even if we don't get tens or hundreds of jabs and arms, I think it's just really good to build relationships with the communities, because that will pay dividends in the long term in terms of other health promotion that we need to do. But it's really heartening to see that we are being invited with these communities. So really looking forward to working with them over the next couple of months.
So thanks, Jo. So we now move on to a sort of another aspect of communication with the community, and Sean. How are we doing out there in the real wide world, Sean?
Thank you, Chair. I've got no slides tonight, but I have got just a quick verbal update for the board. So yeah, out in our world, it's been extremely busy, as you can imagine, because obviously we're very much linked to the prevailing case rates that Matt's already talked about. Obviously, they're coming down now, but in the early part of the month, they were still relatively high. So just to give you a few ideas in terms of numbers, so since the week ending the 2nd of, or including the weekend in the 2nd of February, we've dealt with over 750 cases for local tracing. So as the board will recall, we moved to a system that we call local zero. So effectively we identified a number of postcodes and we actually did the initial tracing on those rather than the national system. And we felt that was the right way to go, given the move to a kind of 5-day isolation period and everything that's had to around that. The good thing about that is we've had a very high conversion rate. So we've been running at around 75, 76% each week in terms of actual full tracing, but a total reach in terms of getting hold of people between about 90 and 94%, which is really positive. So what that means is that 75, 76% basically provided the data or the information that we needed to do the full tracing program. Others basically we were able to contact, but they didn't basically provide that data to us. So it's very, very positive in that sense. Looking at isolation calls, so in the first 9 days of February, I haven't got, unfortunately, the 10th and 11th taken us last Thursday and Friday. We had 1,435 of those came through. So that basically would be in line with the kind of 1,700 or so a week that Mark was talking about. And between the 1st of February and the 11th of February, we had 53 calls to the hub. So that's come down a little bit from last time. And members will know I did actually share that data after the last meeting in the last few days, basically as to how that kind of those calls broke down and what areas they actually covered. So just moving away from local contact tracing and isolation calls, we're still monitoring obviously the notifications from, let's call them higher risk settings rather than the kind of high risk settings, but the vast majority of those that are coming through are obviously from schools, primary and secondary schools, but also we also monitor notifications from the private school sector and also boarding schools and the like. Other areas are obviously early years, some care setting notifications and some isolated workplace kind of clusters that we'll keep an eye on and where necessary making contact with those workplaces and seeing what help and assistance we can provide. Just looking at other areas of the work really, obviously, so a lot of the rules and regulations around that control businesses have gone. They went basically with the end of Plan B restrictions, but the major concentration at the moment is around events, as I've mentioned previously. There is still guidance there for event organisers, and we're still doing a lot of work really with that to try and encourage things like ventilation of their indoor events, staff testing, cleaning regimes, and where appropriate, face coverings. We're also getting, actually, in addition to the normal event notifications, which we would expect a lot of this time of year as we head towards the spring and the summer, we're starting to get a fair number now of event notifications through and plans for Jubilee events. Obviously we wait to see whether there's any further guidance basically issued over the next couple of weeks, basically as we move to the government announcements next week or the week after. So really that's kind of where we've got to. I mean, just looking a little bit to the future, I guess we're as much as anybody else waiting for the outcome of those announcements as to what that means for the work that the service does, particularly around isolation, particularly around local contact tracing, because that's obviously very much linked to the testing regime and the policies around that and the isolation policies, self-isolation policies, and currently obviously the regulations are in place. And the same goes with basically the work that we're doing with event organisers and businesses. So we're just very much waiting for that announcement, and obviously we'll make the necessary adjustments. Thank you.
Thanks, Sean. If I can just develop the question of Jubilee events with you. Clearly, on past experience of national type celebrations, either the government has made an announcement about relaxation of certain licensing restrictions and so on and so forth. And or, in any event, the organisers of that type of event, if they need a license to do something, and in a lot of cases they probably won't, but let's say they want to have a bar, they'll probably do it under a temporary event notice. Now, I'm just wondering what engagement, come control, come conversation you can have or can expect to have with organisers of village events who aren't applying for a premises license. So there's not that whole formal process that they go through, and how we might seek to engage with them to say, look, we can help you, guide you through and give you some indication as to how you might make this event even safer than you intended.
So I think it's an important point you make, and we are receiving questions, obviously not just about kind of the whole things that sit around events, so road closures and everything else, and that kind of stuff's coming into the authority, but also particularly around the licensing issues and basically what type of license they need. And obviously, you say basically for most people that would be a temporary event notice. I think one of the things that occurred to me basically as I was prepping for this meeting was actually probably what we need to do is to move to a position once we've got the latest information over the next couple of weeks, that we pull together some sort of pack for event organisers as soon as possible, really, and get that out to them. That picks up not just the COVID aspects, but the licensing aspects and all the other aspects that basically that relate really to the role of the local authority in facilitating those events safely. Obviously, a lot of them are outdoors, as you can imagine, so a lot of them are the street party type events. But nevertheless, we are starting to get questions, and we just need basically to be in a position to provide the answers.
Okay, and before I move on to the next one, I better reflect, Gordon, that maybe that's a declaration of interest from me, that, as Sean knows, I'm involved with a local community company that has a premises license and intends to use it for the Queen's 70th celebration. So, yeah, I'm in that book. Members, no one itching to ask Sean a question, so we shall move on to comms. Martin, how are we doing on communicating what's happening out to the wider world?
Thank you. Good evening, everyone. I just have 2 slides to share with you this evening, and you will be pleased to know that much of what I was going to talk to you about today has really come up earlier in the meeting. A pitfall or benefit, perhaps, of being at the end of the agenda. So I will whiz through this in fairly short order. So in terms of the 3 areas that we are working on, we're looking at the moment, it won't suffice you to know that these sort of follow the themes that I provided at previous updates. So one of the work streams we're looking at is actually that signposting, that general messaging out to the community, and more broadly, where we have still got testing and vaccination clinics and opportunities for people where there have been changes to rules and guidance and so on. That's been through our newsletter, through social media, through our media briefings where appropriate, and of course through meetings such as this to keep our communities updated on what is going on. As Joe explained earlier, we've been sort of focusing more on our targeted communications, really sort of trying to work hard with our public health team, with Joe and her team, and with our commissioned sort of services as well, to reach those who are digitally excluded, vaccine hesitant, or may just need that little bit of extra reassurance or help. Those where it's sort of a bit more of a personal connection is required, and supporting that as well. So we've been translating, for example, our sort of vaccination postcards so people know where they can get those. We've got a couple here in Bengali and Urdu, and we're just about to translate those as well into Polish, Romanian, and Hungarian. So very much working with our partners to reach that smaller group who haven't yet had their vaccinations. And of course, we've spoken earlier about actually looking ahead and what happens next post the announcement next week. It is very much moving towards living with COVID, and that becoming part of our everyday lives. As Matt said, we just need to have a look at the detail to see what's coming, and that will inform our communications there. We're still linked in with the government communications teams, where we're getting weekly briefings on what they're doing, what we can learn from them, some of their behavioural insight work, and previews of future campaigns and comms coming out as well. And it's an opportunity for us to feed in as well if we think actually that there's something we're seeing on the ground that actually perhaps could be fed in nationally. It's very much a two-way process as well. And in terms of the look ahead and the pack that Sean was talking about, we're looking at producing a pack also for the Jubilee, subject to what comes out next week. That will have advice on for communities on everything from street closures for those wanting to hold street parties through to sort of support with events as well. And we'll be tying up with Sean and his team just to make that happen. And then there were just a couple of other pieces of activity that I just wanted to update you on, really just to conclude the presentation today. We know that over the past couple of years, actually, sort of COVID's touched our communities in a myriad of different ways. We're incredibly grateful to our communities for everything they've done over the past couple of years, in terms of following the guidance, doing everything that they could to keep themselves and others safe, and to minimise the impact on the NHS and other areas of the public sector. So we've got a new magazine coming out to West Berkshire households next month, and we have got in there a page just looking at our COVID response, thanking our communities for everything they've done over the past couple of years in terms of keeping themselves safe, and just talking a little bit about what we've been doing in recent months as well in support of that. And then finally, I just wanted to conclude with sharing some work we've been doing with our communities on a lasting memorial to those, because we know not everyone has made it through, and that sadly a few people have died from COVID. And we wanted to sort of think about sort of an appropriate way to remember those as a community and across the district. So we've been working with town and parish councils on a memorial which we're calling Blossom into Spring, and we've been offering cherry blossom trees to communities who want to create their own local memorial to those who have died. Pleased to say 30 councils have taken up that offer, and across the district so far 113 trees have been planted, cherry blossom trees chosen, because they're a nice sort of visual and poignant reminder in our communities, but also because they blossom at about the time of the first lockdown. It's an appropriate time, I think, to remember those people there. So just here we've got some photos of communities in Pangbourne, Basildon, and in Stroud Green as well, out planting their trees, and that's just something that we've been sharing with our communities across our channels over the last week or so. So that concludes my update. I'm happy to take any questions or comments.
Thanks, Martin. And I don't see anyone itching to ask you a question. So I just thank you and the team for doing what you're doing, because obviously this is extremely important that we keep getting that messaging out. Members, we now come to the question of future meetings. I am going to say what I said last time, which is I am going to look to our public health team, coupled with Tracy as Director of Public Health for Berkshire West, to advise me as to whether or not we should hold another meeting. It's possible, reflecting on what's been said this evening, that this may be the last local outbreak engagement board that we hold. And if that turns out to be the case, then first I think that's good in a sense. Obviously we haven't lost COVID. COVID is going to be with us for a very, very long time, I suspect. But it does mean, I think, that the effect of COVID upon the generality, and I really want to emphasize the generality of our community, has lessened. That isn't to say that there won't be specific instances where there is still tragic effects of COVID, and indeed Matt reflected on the question of long COVID, and I think long COVID is going to be a very major question for society going forward. But in terms of West Berkshire Council's response to the pandemic, this may be the last time we meet. If it is, I want to thank you all for your time and efforts and for being part of this grouping, because I think we have served a purpose. We have kept the public informed and guided, in particular, the comms piece in order to make sure that that messaging goes out. So thank you from me for your attendance and being part of this. I'll now see whether anyone actually wants to disagree with me on anything I've just said. And I don't see any of you itching to do so. And unless anyone has anything else they want to raise, I will call this meeting to a close and ask you to remain in the virtual room until Gordon has said that we're no longer live streaming.